Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, one of the MCs here at Gold, and I'm also a licensed midwife. And here at Gold, we are getting ready for our Labor and Delivery Symposium. And one of our speakers here is here with me today, Nikki Zerfas. Welcome, Nikki. It's so good to have you here.
Hello, Kristen. Thank you for having me.
Wonderful to have you here. We're excited about the symposium. Your presentation is titled Physiology Leads the Way, Supporting Medically Complex Pregnancy and Birth with Physiology. Woo, the topic, I love that topic. I have to tell you, I'm very excited about this, that you're going to be talking about that. But before we hop into the topic itself, tell us a little bit about yourself and your background here.
So I came to nursing as a kind of a second career, although I feel like I didn't necessarily have a career before then, other than I was a little bit of a vagrant. I moved around. I worked at I worked at summer camps and taught English in France primarily, and and then decided I wanted to go into nursing. And I didn't necessarily know I wanted to go into maternal care, but I had a feeling, and and then it just happened that it was logic for me. I think that the three things in my life that just have always made sense is when I studied French in school, it just made sense. It was easy. It was logical. I felt the same way with lactation when I first started working with as in postpartum. I felt that way about lactation. And then when I moved into the labor side of things, the pieces fit in like they were just waiting to be put there. And so and the first hospital that I worked at, it's a university hospital. They have a 5-state draw area. They have relatively low volume, but extremely high acuity. So basically, your highest risk, most problematic pregnancies throughout that 5-state area are all brought in there. And my goal was not necessarily high risk OB, but you have to take the job you can get. So I thought, well, I can bring in that physiological side for these families that have high risk needs. But then I got there, and amongst my colleagues, I had the most amazing colleagues because there were several of them, including some of our residents who'd been doulas prior to working there.
Oh,
There
that's
were
wonderful.
several who'd been both home birth and hospital birth midwives before working there, and several, including some of our attending physicians who had had their own home births. So really you had this team that everyone was looking for ways to bring physiology in, but we weren't quite sure how to do that. And so working with some of these wonderfully experienced nurses that I met while working there, I started to put together the pieces and understand the physiology a bit more, which was where I encountered spinning babies and then became a bit of a groupie there, and and eventually was invited to be a trainer.
That's fantastic. Well, it sounds like you got to start in a really great place when you said your colleagues, they were on board with that. They had their own experiences. They were doulas prior to that, or even had a home birth. Some of them, that is probably a very unusual situation. I can also imagine, some hospitals or facilities where there is a very medical background, right? And I am sure now you've seen a lot, you've taught a lot. You probably have encountered some barriers as well, right? Like, can you speak to that a little bit? What have you seen when you were teaching or when you were got to look into other facilities? They are saying, yeah, that sounds nice. And then the big but is coming, but
Yeah.
here we can't do that, or but we don't have the resources, or we don't have
hmm
this. So tell me, what is your strategy for that?
Well, I think first of all is that when to take everything all at once is just too much, and it's overwhelming, and it feels impossible, and it is impossible.
Mhm.
So you can't try to do everything at once. You find that one little piece that seems doable
Yeah.
so that you can feel like, hey, we did it, it worked. And once that gets put into place, then you can add that next little piece little by little. When I with the people that I meet with teaching, a lot of times it seems like the biggest thing they fear, I don't know that they fear, some people fear it and some people just see it as impossible, is anesthesia.
Hmm.
And their anesthesia teams not being going along with it, or that the anesthesia methods that are used have these really strong, heavy epidurals where people can't move around and you're
Right.
going to hurt your back to try to help move them. And the biggest thing that I loved the anesthesia team at that first facility I worked at. I mean, I'm good friends with several of them, and I've learned so much from them. And more than anything, I learned that they're part of the team. So
Yeah.
many places, anesthesia themselves sees themselves as ancillary to obstetrics, or obstetrics treats anesthesia like they're an outside part of the team. But in the United States, depending on the facility, anywhere from 60 to 90% or 95% of births are going to have anesthesia involvement in one way or another. And so if they're involved in that many, they are not ancillary. They are part of the team. And so when we're wanting to improve our outcomes, they need to be invited into the project. And then we can say, then we can bring in that, well, on the nursing side, we are trying to decrease our C-section rate. And the way from nursing's perspective that we're trying to do this is encourage more positioning. We have difficulty because the epidurals always seem to be so heavy and they
Hmm.
can't move around. What are you doing from your perspective in anesthesia that can influence that?
Hmm.
And bringing them to task. What does their professional organization say? Because the standards do support mobility.
Yes,
They do.
absolutely. Yeah, and you brought up this important point. Make them part of the team, and you are so right. What you mentioned is often this auxiliary outside. From they're coming in with their cart and setting the epidural and moving out again, going to the next one. So it feels like almost like an outside service, which it
Right.
isn't, and kind of not part of the team. So bringing them in, that's really a genius way of doing that, right?
Yeah.
Making them part of the care of the plan and maybe getting also their opinions of, hey, maybe they're also excited to do something different or bring a change or,
Yeah.
be part of the conversation and not just like this outside entity coming in and moving out. So
Right.
I'm sure, yeah, maybe there are barriers for that as well, but it could also be an exciting opportunity for the anesthesiology team to be part of the process.
Oh, yeah, definitely. I think inviting them in, it gets their buy-in. They want those
Mhm.
rates to go down lower too. And when you get a full team approach like that, I taught at a facility last year where they had all of their nurses, as well as all of their residents,
Mhm.
and a handful of their attendings and midwives, and even three of their anesthesiologists attended our workshop.
That's
And
fantastic.
it was so beautiful. Those
Oh, I love that.
anesthesiologists that came, especially because being a teaching facility, then those anesthesia fellows are going to go out around the world and they're going to
Yes.
bring that to where they go.
Yes, yes, absolutely. And yeah, absolutely love hearing that because spreading the word, spreading the knowledge, teaching others
Hmm.
and that makes me so happy just listening to you, hearing all that. That's really, really, really good news. Um, let's also talk about the parents here, the birthing person, the mother. There, it's being a medically complex in a medically complex pregnancy or birth is very different from your ordinary, usual, low risk, let's call it that, birth, right? I mean, there is a lot of fear involved. It is scary for the parent. They don't want to do anything wrong. They're so, worried that something could go wrong or they had a difficult pregnancy, just wanting to have the baby and all that. And we're also talking now about patient autonomy as well. How can as healthcare providers we work with the parents and not only educating them, but also, making sure that they can be the active partner in their birth. There should be the active partner. There shouldn't be there should be or are the active partner in the birth, because I can imagine there's a lot of fear on their side, of course, as well in there.
Hmm. I think that I've always felt like the longer someone stays in hospital in pregnancy, the less it feels that their pregnancy belongs to them.
Right. Yeah.
And so I really think that finding ways that they can take ownership of the process and of the information, whether it's, and it has to be individualized, and everyone needs a different thing. One person might be someone who needs people to follow my schedule. So I'm going to set up what time I want my nurse to come in. And
Mhm.
maybe that's the little bit of control that makes me feel human again.
Mm.
Or maybe, but giving them as much information. And I know, like when we think about people with diabetes, and especially if it's like type 1 diabetes or type 2 diabetes that they live with outside of pregnancy. But with diabetes, I really, really try to encourage the pregnant person to take ownership and to get their questions answered so that they're the one that understands, because this person's type 1 diabetes is going to be different than that person's type 1
Right.
diabetes. And so when I come in as a care provider, I know the generalized view of diabetes, but I don't know how theirs is. So like my
Mhm.
first question, I like that if I'm working with someone, say they're a type 1 diabetes, my first question as we're getting to know each other, one of those first questions is, how do you know when you're low? What's
Mm.
your symptom? What's your thing that tells you, ooh, something must be off? And because it's different for everyone. And so
Mhm.
recognizing that they are the expert in their body,
Right.
and that I am there to accompany and help in any way I can, but they're the expert in their
Mm.
own experience. And by doing that, it gives them that ownership, not only of whatever medically complex condition might be going on, but it invites them back in to then be like, okay, so if that's how you are when you're not pregnant, has that changed since you've been pregnant? And
Mm.
recognizing that they're also the expert of their pregnant body.
Right. Absolutely. Oh, I love you saying that, the expert of their pregnant body, and then after birth, the expert on their baby. Right.
Yeah,
So I
absolutely.
absolutely love that. Love hearing that. Oh, I can't wait for your presentation here. The presentation title again here for our viewers: Physiology leads the way, supporting medically complex pregnancy and birth with the physiology. So, Nikki, before I let you go, any final words for our viewers? Anything that you think they hope to take away from your presentation?
I think that, well, what I hope people are able to take whenever I speak or teach, I really want you to be able to picture how this would be in your practice. Because
Mm.
if you can picture it, then you're that much more likely to put it into action. And so I know there are barriers, and I know there are challenges, and there's pushback everywhere. But when we find the key, we find that tiny little way to bring at least one little thing in to start with, the energy that you get from improving practice in one little way gives you the motivation it takes to push through the next thing.
Oh, love that. Gives you no motivation. Absolutely love that. Nikki Zerfas, so much. Thank you so much for being here with us today. And thank you so much for presenting at Gold at the Labor and Delivery Symposium.
Thank you, Kristen.
Some information now for our viewers. Our symposium, we do have a live keynote presentation for that. That will be live in October. And if you would like to find out more about all the presentations in the symposium, we invite you to go to goldlearning.com to find out all the information there. Thank you, everyone, for watching and participating here with us at Gold today. Have a lovely rest of your day, everyone. And I hope to see you at the symposium. Bye-bye, everyone.